Hello, and welcome to ET Deep Dive, a new series where we take the best stories from ET's long-form reportage and bring them to you in audio. No headlines, no bulletins, just long-form storytelling the way a good feature deserves to be heard. Today's episode is built on Lijee Philip's story on India's emerging age tech sector. The startups, the gaps, and the quiet crisis of a country growing old faster than it knows how to take care for itself. It's Sunday, the 5th of April. I'm Anirban Chowdhury. This is the Morning Brief. One evening, a man's daughter walked through the front door of their home. He looked at her, and he could not remember her name. Just a few seconds, that's all it lasted. But by the time he sought help, by the time anyone realized something was wrong, the window for meaningful intervention had largely closed. Another story, a father in Delhi. His 41-year-old daughter had been diagnosed with early-onset Alzheimer's disease. He went from hospital to hospital, including AIIMS, one of the best medical institutions in the country. At each one, he was told, there is little that can be done. No roadmap, no support system. These are not isolated stories. They are symptoms of something structural. A country aging faster than ever before, and a care system that has not kept up. India's traditional caregiving model was based on the joint family. But joint families are giving way to nuclear households. Children are moving to other cities, other countries. Nearly 27% of urban seniors now live alone or only with their spouses. And almost 75% are living with one or more chronic conditions that require sustained, ongoing care. The state is not equipped to fill this gap, and the gap is widening every year. We've seen families struggle with situations they were not equipped to handle, says Ishan Khanna, CEO of Antara Assisted Care Services. An aging parent who needs help with daily activities, someone recovering from surgery with no one at home, a family dealing with dementia and not knowing where to turn. This is the crisis. It's quiet, it's domestic, and it's happening at enormous scale. But here's what makes the moment different from any that came before it. The seniors at the center of this crisis are not who we think they are. Because this is the most financially secure, most aspirational generation of older Indians that India has ever seen. Many have pensions, investments, income from property. They are digitally aware, increasingly health conscious, and willing to spend on improving their quality of life. According to the 2011 census, India already had close to 100 million people above the age of 60. By 2050, that number is expected to cross 300 million, nearly a fifth of the entire population. But that is not a future problem. That is a present market. Neeraj Sagar, who runs Wisdom Circle, a platform connecting retired professionals with meaningful work, puts it plainly. The elderly want relevance, engagement, contribution, identity. They don't want to be serviced. They want to be respected and useful. The opportunity for age tech, then, is not just to manage decline. It is to extend purpose. Aging is no longer only a healthcare problem. It is a lifestyle problem, an economic problem, a social design problem. And the silver economy taking shape around it is no longer a future projection. Into this space, a new wave of startups is moving. Take cognitive health, by some distance, the most complex and most underserved challenge in this space. Ivory, a Bengaluru-based company, runs neuroscience-based digital assessments to detect early signs of cognitive decline. A few years ago, nearly 70% of users seeking diagnostic support were over 50. Today, it is almost evenly split between those aged 40 to 50 and those above 50. Younger people are coming in proactively. A 35-year-old signed up for annual cognitive testing simply because he had watched his grandfather suffer from neurodegeneration and wanted to act early. There's a sea change, says Ivory co-founder Isaac John. People are talking about brain fog, forgetfulness, attention issues. These are conversations that simply did not exist a decade ago. Global studies have shown that cognitive decline can be slowed through multimodal interventions: diet, exercise, sleep, mental engagement. When we detect changes early, we can intervene meaningfully, says Ivory founder John. So, cognitive assessments will eventually become like a treadmill test for the brain. Then there is fall prevention. Falls are among the leading causes of serious injury in seniors globally. India barely has the basic infrastructure to address them. Kubo Care, a Bengaluru startup, is approaching this through predictive monitoring. The catastrophic fall that sends someone to the hospital isn't the first fall, says Kubo's co-founder Anurag Ramchandran. It's the smaller, unreported incidents that build up risk, he adds. Kubo Care uses proprietary AI and radar-based sensors installed in homes to track daily movement and generate personalized fall risk scores. No cameras, no intrusion on privacy. It's just technology operating quietly in the background. What they call ambient care. Antara, meanwhile, is redesigning everyday walking aids and integrating them with fall detection, SOS alerts, and wearables. And Marzi by Primus is building around the insight that seniors' needs don't begin when they enter a care facility. They already exist at home, says founder Adarsh Narahari. Safer bathrooms, healthcare access, companionship. And then there is Samarth Healthcare, which provides end-to-end elder support across 200 towns and cities. Their model is based not on finding exceptional caregivers, but on building robust care systems. For instance, during a routine visit, one of their care managers noticed something off about a client. Slightly labored breathing, low energy. The client insisted he was fine. The caregiver insisted otherwise. A hospital check revealed a severe lung infection already affecting multiple organs. Doctors said a delay of even 24 hours could have been fatal. His children, living abroad, later called the caregiver their guardian angel. But for all the momentum in this sector, two hard constraints keep limiting its scale. The first is affordability. Senior care in India remains almost entirely out of pocket. Nearly 40% of all healthcare expenditure is borne directly by households. Long-term care, that is assisted living, rehabilitation, memory care, is rarely covered by insurance. Urban seniors are already spending up to 30% of their income on health-related needs. And yet, organized, high-quality care remains out of reach for most. Aging needs are continuous, says Khanna of Antara, but insurance frameworks are still hospital-centric. Until long-term care is integrated into mainstream insurance, the market will grow, but well below its potential. The second constraint is cultural. In India, caregiving is traditionally a family responsibility. Outsourcing it, even to trained professionals, can carry profound stigma and guilt. Families are not just evaluating a service. They are, as Kubo Care's Chandran puts it, rethinking long-held beliefs about what responsibility means. Aging is not a single problem, says Sagar of Wisdom Circle. It spans health, lifestyle, financial planning, and social connection. The founders building in this space are realizing that isolated solutions won't work. Only models gaining traction are the ones that address all of it together. Of course, there are signs that the constraints are beginning to ease slowly. The COVID-19 pandemic was a catalyst. For families with members living abroad, it exposed the fragility of distance. According to Summit's data, nearly 68% of families now want to plan long-term support for aging parents, compared with less than 35% before the pandemic. And seniors themselves are changing. Around 30% of families surveyed by Samarth report that parents now co-create or independently decide their own care plans. They are beginning to see professional care not as dependency but as empowerment. At the Indian Institute of Science in Bengaluru, something called the Longevity Initiative is studying aging through a multidisciplinary lens, separating genetic, lifestyle, and biological factors specific to India. Lower muscle mass, higher visceral fat, unique dietary patterns. This is research that could eventually reshape how care is designed for 1 billion plus people. Senior care, by its nature, is built on trust, on empathy, on relationships. The future of this sector lies in integration, platforms that bring technology and human care together seamlessly, not one replacing the other. Technology in the background adding efficiency and insight, human caregivers at the center. It will take time for these startups to make their full impact felt, but their success will not be measured only in market share. It will be measured in how many Indians can finally face old age without the long shadow of fear. That's it for today. This was the first episode of our new series, ET Deep Dive. It was reported by Lijee Philip, sound designed by Indranil Bhattacharjee. Other episodes of The Morning Brief drop every Tuesday, Thursday, and Friday on a listening platform of your choice. Stay tuned.